I'm Stephen Pannel, a psychiatrist and the Chief Medical Officer with Right Track Medical Group. ADHD is Attention Deficit Hyperactivity Disorder. It's a condition that people have when they have difficulty with attention and focus and hyperactivity, as well as impulsivity. It's a psychiatric condition that we can treat with medications, and a lot of people suffer from this condition. ADHD typically shows up in young patients around the age of 5 or 6 years old, and it develops and will increase over the course of the lifespan. We frequently have people that come in for help with these kinds of symptoms as early as the first grade. We frequently see this as well in other big age groups around 9 years old, 10 years old, again around 12 or 13 years old as well. It's not uncommon for adults to have it and come in after they're 18 or older as well. Primary symptoms we see with ADHD are mostly related around attention and focus. It's a difficult time for young people to be able to maintain long periods of attention and focus, especially in subject matter or materials that they don't prefer or that they struggle with. This also can be involved with having behaviors related to impulsivity, hyperactivity, and difficulty following directions. One of the things we'll see is that parents and teachers will start to notice that it's just really hard for young people to follow directions, stay seated, and just continue to do things that they've been able to do at an earlier age. If you think your child has ADHD, you should bring them in for an evaluation. There's an assessment that can be done to determine if people have difficulty with attention and focus or have symptoms with ADHD that might need treatment. So ADHD in adults can look a little bit different. There's usually a lot of attention and focus problems, but we may not have quite as much hyperactivity or impulsivity. And so if you're an adult and you're struggling with college or work or personal life, and you feel like that you may have ADHD, I would encourage you to come in for an assessment to see if you may benefit from the treatment. So to be evaluated for ADHD is pretty easy. You come in and you sit down with someone and they will have a conversation with you over around 30 to 45 minutes. Sometimes it takes an hour. And they ask a series of questions of how you're doing with your academics, how you're doing with studying, how you're doing with activities in your personal and daily life. And then usually with that discussion and some other information from family members, we can make a decision about whether you have ADHD or not. In an evaluation, clinicians are looking for a history of trouble with attention and focus. We also ask questions about ability to stay organized and be on time and get things completed like they're supposed to be. One of the things we do as well is talk to families, talk to people who know the patient well, and ask them history about difficulties that they may have noticed or observed as well. Some of the symptoms that people talk about a lot are the impulsive ones or the hyperactive ones. These are the ones that will get people into trouble at school, get them into trouble with teachers, cause difficulty with driving and things like that. So these are some of the ones that get a little bit more attention. If someone is diagnosed with ADHD, the next steps would be to talk with them about potentially receiving treatment for those symptoms. If the symptoms are severe and they're causing problems at school or problems at work or problems in the home, there's a lot of different ways you can help a person with ADHD. We have people that can do individual therapy to teach skills and organization and work on it from that standpoint. There's also quite a few different medication options out there if people are interested in taking medications to address ADHD symptoms. So the treatment for adults is really similar to the treatment for ADHD for children. You can do individual therapy or you can take medications, and we have a lot of adults that will do both. Treatment options that are available for ADHD are individual therapy as well as medications. The individual therapy will have a person meet with somebody who will teach them skills to change organizational strategies and work on impulsivity and hyperactivity and different strategies to address their ADHD. There's also medication options that are there. Would be a medicine that you would take every day to deal with the symptoms. So if someone is concerned that their kid or someone that they know has ADHD, I would tell them to come in for an evaluation as soon as they can. The earlier we find out if you have this diagnosis or not, the sooner that we can start treatment. And the sooner you start treatment, the better the outcome is for the patient.